Hi, I'm Dr. Krishna Patil. Today we are going to discuss about outcomes of kidney transplant. Any patient on dialysis, when thinks about going for a kidney transplant, the first question that comes to their mind is it safe? How long will I survive after a kidney transplant? Is it that I can be off dialysis, or there are chances that I will land back again on dialysis? So let's understand what are the outcomes or what are the possibilities after a kidney transplant. If we look at the graft outcomes or the longevity, how long the kidney patient lasts, the worldwide data approximately suggests that 1 to 5% of these new kidneys may get within a year span after transplant. 5 to 10% of kidneys may be lost by the end of 5 years. And 25 to 30% of these grafts or new kidneys may be lost by the end of 10 years. So kidney transplant is very safe and it's a life-changing surgery, but not without failures. There are failures also associated with it. So what are the common reasons for a graft failure? The three most common reasons would be rejection, infection, or recurrence of the basic disease. There are many other causes like toxicity of drugs and many other causes, but these three are the primary reasons because of which the graft may be lost. Rejection. What is rejection? See, an organ that is foreign to us, when it is placed into our body, our immune system recognizes it as foreign and tries to get rid of it or rejects it. So such patients after transplant are placed on anti-rejection medicines which will reduce the immunity of the patient. By reducing our immunity, we prevent rejection. But at the same time, coming down on immunity puts the individual at risk for infections. So post-transplant, the first 1 year is a critical balance of the immune system, not to allow rejection and not to allow infection. So very close monitoring of creatinine and other parameters is required. And anytime if there is any deviation in the kidney function, a kidney biopsy or the graft biopsy is done to understand the cause of the graft dysfunction and correct it immediately. So this goes on lifelong, this fight between our immune system and the organ. And so a kidney transplant patient has to be monitored at intervals appropriate for that particular individual lifelong. The recurrence of basic disease means the disease which affected the patient's original kidneys at first place. That disease may also recur into the new graft. So these three are the common reasons why a graft may get spoiled, and we need to be very vigilant throughout lifelong for these patients to detect graft dysfunction and preserve the graft function. Despite of all this, 30% of them may lose their graft by the end of 10 years. So kidney transplant is very safe. It's a life-changing surgery, but not without failures. And we should understand the pros and cons and choose the right candidates and go ahead. Thank you.